Hey, Ellyn did run for office. I see recently that she has a new job with Aflac. Congratulations, Ellyn Hilliard.
Thank you. I'm Ellyn Hilliard. As many of you know, I've been working against socialized medicine, universal health care for a long time. About 15 years now, I've worked as a cancer nutritionist, and I've seen the choices for patients dwindle until finally Obamacare was passed. Now, January has arrived, and no longer am I able to try to fight the good fight against the socialized medical program being foisted upon us. Now, it's already being implemented, and many of you are subject to the tax, the fee, or the penalty of having to have health care that the government deems important for you. Groups are encouraging all of us to opt out. Some of those groups are telling us that there are principles behind it, yet the consequences of opting out mean that you will get a tax or a penalty. Although there are exemptions, as we all know. If you're a favored business, you certainly get an exemption. If you're a union, you get an exemption. If you're a congressman or his staff, you get an exemption. But also, if more than 8% of your adjustable gross income goes to health care, you get an exemption. The fee is 1% or $99, 1% of your income this year in 2014, and by 2016, it'll be 2.5% of your income. But tens of millions are opting out, and statistics now show that we'll have more people uninsured under Obamacare than we ever did beforehand. So let me tell you how you can opt out. This is how you do it. Number one, there are healthcare ministries that share pools in which you can contribute to someone else's health care bill, and at a time of a health crisis, they will contribute to you. Not only is this a great idea, and it had been done for decades before Obamacare ever came along, in this particular example, even if your cost of health care is not more than 8% of your income, you will be exempted. One of those organizations, and I encourage all of you to look it up, is Liberty Health Share. You can find them on libertyhealthshare.com. What they do is they take a fee from you. I looked it up to get an idea for this speech that I was thinking about doing, and it's about $156 a month for me to choose the silver plan. That's much less than I was paying with Kaiser Permanente at my $179 a month before they jacked it up to $550 a month after Obamacare. A second option is to take out a short-term health policy. Many insurers, especially healthcare brokers, can get you a policy for 1 to 11 months that's renewable, and because it doesn't have all the bells and whistles of Obamacare, it's not subject to all of the mandates. Therefore, those short-term policies are a lot less expensive. They usually range in about the 6-month period of a plan, and because they're renewable, you can opt in again. And they range in the ballpark of about $79 to $200 for an individual. The third is what we call alternative plans. Again, they don't fall under Obamacare. They're very specific, and because they don't carry all the bells and whistles that are required by Obamacare, you can get these plans for a very, very small amount of money, about $6 a week. They're called lump sum plans or accident insurance or critical illness plans. That means that you would be insured for a very, very specific amount. Let's say you want to insure yourself for $100,000 cash lump sum in case of accident or injury upon a diagnosis or hospitalization. And you can pay as little as $6 a week in order to get something like that. Now, once you've checked out your options and you know what's available to you if you opt out of Obamacare, and you have already got yourself into something that's going to protect you so that you're not just completely laying yourself vulnerable to a high medical cost in case of a serious accident. There are other options, because now you have to start shopping. And here are several that you'll need to look for at the time of the illness or accident. Look for cash-only doctors. There's lots of them out there. Many are opting out of Obamacare, Medicare, and Medicaid. Or direct primary care practices, like the one over here, Nextera in Prospect, in which you pay a small fee. It's $145 a month for Denny and I. And what that covers is all free doctor's visits, diagnosis, and the doctor's discount on all diagnostic testing, and referrals to specialists at a reduced fee. Second, Tele-med Services with video connections, in which you can get small diagnosis for things you might think would be flu or some sort of a cold or maybe a sprained ankle, and you can get it right online. And third, for your prescriptions, using generics like they offer at Target and Walmart, or their special plan in which for $4 for 1 month, you can get a prescription. Or go to goodrx.com, which is an online prescription service where you can actually sign up for discounted prescription medications. And fourth, for the local hospital bill, in case you happen to be hospitalized, look for Medi-bill negotiating, in which you can actually have someone negotiating for you and reduce the rate on your hospital bill. Now, if you decide to do that yourself, you can also look the Healthcare Blue Book. It's also online, so you can find out what the average cost of the service is that you're getting from the doctor or the hospital. So opting out is serious. This is not something to be taken lightly. People go bankrupt. 77% of all the individuals that do go bankrupt because of medical costs end up going bankrupt because they don't have proper insurance or coverage or haven't put a plan together. So I urge you to do so. And this is a decision that you need to make right away, because it is January. You will be subject to the tax or the penalty. And one more interesting tidbit, if you don't plan for what's happening with Obamacare, know that the only way they can collect that is if you have a tax refund coming and they collect it from your IRS check. So now that you're prepared and you know what to do, I expect that everyone in this room is now going to take medical precautions and get themselves covered in one way or the other. Thank you so much. I hope I was able to give you some ideas on how to opt out of Obamacare.